Hi everyone, Dr. Kalaiko here, and I'm checking in with an update on the batch of Moderna vaccines that we mentioned we had to pause distribution of under the advice of the California Department of Public Health. So we do have some good news. The Department of Public Health has given us the green light that this batch and this lot number of the Moderna vaccines is safe to go ahead and continue giving out. So there was an investigation that the Department of Public Health undertook, which included a work group of experts. So this included epidemiologists, allergy and immunology specialists, as well as infectious disease physicians. And they looked at what actually happened at that vaccine clinic in San Diego, where we had a group of people having side effects to the vaccine. So what happened is that 7 people at this drive-through clinic in San Diego had angioedema. So that's swelling under the skin. Typically it happens in the face, the tongue, as well as the throat area. And all 7 people were treated for their symptoms and they all recovered fully. None of them had anaphylaxis. So anaphylaxis is a serious, life-threatening allergic reaction. None of them had that. None of them had any life-threatening side effects. And what we know is that almost 1 million doses from this particular batch of vaccine were already distributed around the United States. And out of those 1 million doses, 7 people had this reaction, and they all happened to be at this one drive-through clinic. No other clusters of similar side effects were identified at any of the other vaccination centers that this lot number was distributed to. So given this information, given the severity of COVID-19 disease and the need to vaccinate the community and the current short supply issues that we're encountering right now, and the fact that these particular side effects were not observed in other patients in any other vaccination clinics, the work group concluded that it is safe to resume using this lot number and this batch of Moderna vaccine. So all of this to say that this is all evidence that the process is working as it should be. So this is showing us that the departments of public health are very closely monitoring any red flags or any signals that might come up that might tell us, okay, we need to put certain batches on hold just to do a thorough investigation and make sure there's nothing wrong with the vaccine. It appears that was not the case, and that it was just that these individuals were having very specific individual reactions to the vaccine. And their quick response to immediately tell us to put a pause, on this batch of vaccine, that was really taken out of an abundance of caution. So this is all part of the process. Whenever any medication or vaccine is distributed through the community, is if any signals or red flags come up, that we take quick and immediate action and take a closer look when we need to. But it does appear in this case that they did not find anything wrong with this particular batch or lot number of vaccine, and it is safe to continue using it. Now, as of now, our particular pharmacies, Komodo pharmacies, have not received any vaccines with that lot number at this current time. But if any other clinics or pharmacies out there do, have that lot number and offer it to you, I want you to feel confident that it is safe to go ahead and receive that vaccine. If it was offered to me, I would go ahead and receive it myself as well. So hope that helps clear up any questions that you might have. And if you find these videos helpful, feel free to give this video a like and also subscribe, because that will help us to kind of amplify our messages out there in the community, and it will also help you to get notifications when new videos become available. Thank you.